The kidneys play a vital role in maintaining the body's overall health by filtering waste products, regulating electrolyte balance, and producing hormones. However, various kidney disorders can disrupt these essential functions, leading to significant health problems. Kidney stone that form when there is too much build-up of certain substances in the body, leading to the formation of hard deposits in the kidneys. 2. Chronic kidney disease that occurs when the kidneys are damaged and lose their ability to function properly over time. Urinary tract infections that occur in the urinary tract, which can include the kidneys, bladder, and urethra. 4. Glomerulus in which the tiny filters in the kidneys become inflamed and damaged. Leading to decreased kidney function. Causes. The causes of kidney disorders include dehydration, genetics, and medical conditions such as diabetes and hypertension. To take care of oneself in such situations, it is important to maintain a healthy diet. Stay hydrated, exercise regularly, and avoid smoking and alcohol. It is also essential to manage any underlying medical conditions, such as diabetes and hypertension, that may contribute to kidney problems. General treatment. The treatment options for common kidney disorders are multifaceted, aiming to slow disease progression, manage symptoms, and preserve kidney function. Treatment plans are individuals based on the specific disorder, stage, and severity of the condition, consulting with healthcare professionals, including protologists, neurologists, and primary care physicians, is essential for accurate diagnosis and appropriate treatment with proper management. Individuals with kidney disorders can lead fulfilling lives and minimize complications associated with these conditions.